ठीक है, आ जाइए।
वाकई में उस तरह
Yes.
प्रॉब्लम नहीं है। और
क्या नाम है आपका?
मामूनुर रशीद। मामूनुर रशीद।
कहाँ से आए हैं?
बांग्लादेश से।
बांग्लादेश से।
यस
तो एक सेटिंग हो गया था आपका, है?
यस यस।
कितने महीने पहले हुआ था?
3.5 मंथ पहले।
3.5 मंथ। अभी कैसा महसूस कर रहे हो ये एक सेटिंग के बाद?
It is improved. I feel
Improvement
the
is there.
improvement. Yes.
Okay.
That's why I came. Otherwise, I didn't.
Okay. So what are the improvements you are observing?
Observing before first sitting, there was some pain was there. Also, I started exercise. Due to exercise, I relieve a lot, but there is some pain. But
Okay.
after first sitting, that also reduced.
Okay. That pain is also reduced.
Yes.
Okay. There is no limping in your walking.
Limping almost gone.
Almost
Very
gone.
slight.
Okay,
That is
very
when I stay 1 hour in a
Uh-huh.
seat. Then when I start, then there is a little bit.
Okay. Okay. Just show me a movement like this. You can do this.
Movement is not so improved, but
Okay.
from previous it is improved.
Previously, it is good.
Yes, yes.
Okay. What is the grade in your MRI?
It is 3 and 2.
3 and 2. Lift your another leg. It is quite good. Okay.
Yes.
Open your leg like this.
Opening no problem.
Very good. No problem at all. No pain at all.
Only lifting is problem. Otherwise, no problem.
Only left third one is there. Huh? Okay. Okay. So it will take 3 sittings. This is your second sitting.
Yes,
So let's see what are the changes after completing this session. Okay. Thank you. चलिए आ जाइए। वेरी गुड। तो मेमनूर राशिद जी है
Yes.
फ्रॉम बांग्लादेश।
Yes.
है? अभी क्या ये सेकंड सिटिंग हो गया?
Second sitting.
तो हाउ आर यू फीलिंग राइट नाउ?
I'm feeling better from the last sitting because after last sitting, I feel the improvement after 1 month later.
Okay.
And during first sitting, I did not feel the instant response. But right now, I'm feeling the instant response.
Okay.
I think it is a very good sign. And till now, I have that kind of pain. Almost 98%, I'm okay.
Almost 90% you are okay.
Only on lifting problem, I think it will be
Go slowly.
up to next sitting. It will be go.
Yeah.
I hope so.
Just show me your range of motion like this.
This one is
Is
Slightly
facing
limited.
some little bit difficulty.
Yes, yes.
On next method.
this one is okay.
This one is okay. Open your leg.
Open, it is no problem.
No problem. Okay. Okay. That means you are feeling 90 to 95%.
Yes.
better, eh? So what do you suggest to the other avian patients?
Other patient is most of the surgeon is suggest to replace the hip replacement, but that is, I think, that is the last option.
Yeah.
Before doing the hip replacement, we should try this because without this we have no option.
Yeah.
And after trying this, I am feeling better. A lot of other patients also feeling better.
Yeah.
So before going to hip replacement, we should try
Straight to this.
once.
And the basic thing is that actually it works on the root cause of the avian.
Yes.
Okay, because most of the patients are suffering with the avian in the both hip joint as well as in the shoulder also. That
Yes.
means there is a lot of difference or lot of places in the body where we can feel the avian, and this treatment work on that.
Yes.
Okay, so happy with the treatment?
Yes, I am happy with the treatment. Okay.
Hello friends and welcome to all of you. Myself Dr. Vijay Prakash from Saubhagya Ayurveda, Haridwar, Kanpur, senior resident doctor at Saubhagya Ayurveda, specialist in avian and spine and joint related problems. तो फ्रेंड्स एवियन की सीरीज में एक पेशेंट और है जो मेरे पास बांग्लादेश से आए थे और इनका नाम है मेमनूर राशिद जी। मेमनूर राशिद, नमस्कार। इनको एवियन की समस्या थी बट इन्होंने ये दूसरी सीटिंग ले ली है। इन सब चीज़ों को जानने से पहले इनसे जानेंगे सबसे पहले फर्स्ट ऑफ ऑल इनको कब एवियन स्टार्ट हुआ। तो राशिद जी बताइए फ्रॉम द बिगनिंग। इफ यू आर कंफर्टेबल इन इंग्लिश यू कैन स्पीक इन इंग्लिश और बांग्ला यू कैन आल्सो।
Okay. First, I realized pain in my hip at 2022 February.
Okay.
After 1.5 months treating normal doctor, they suggest some painkiller, but after that it is not solved. Then I went to one specialist. He suggests MRI, and after 2 to 3 months later, it realized that it is avian.
Okay.
And that time it is only second grade.
Okay.
And then it is new type of
Disease.
So I searched the internet, Google, everything, and what is the best solution. And if, after searching your video also, that time I saw one week also did the exercise also. But at the same time, I have another option that was before, without replacing the hip replacement, there is some core decompression or like this. So that is not, should not be decided by myself. That should be decided by the student. That's why I came at the one specialist, and he suggests core decompression both side. I expected only one side he will drill, but he suggested both side. So I did at 2022 July. After that, after core decompression, I had to 1.5 months at bed.
Bed rest.
I had to only use the wheelchair. After 1.5 months, I used the crutch. Another
Crutches.
1.5 months, then I start to work. But after that, it is not fully cured. There is some pain right leg. Initially, there was some limping, and after another 1.5 months, I realized little bit comfort, but not fully comfortable. Then I went again the doctor after 6 months. He suggests some medicine, and that medicine, maybe some amitriptyline type of medicine. After taking this, that pain gone.
Okay.
Then around 6 months, I was very good, no limping. But there is problem lifting, but no limping. After finishing the medicine, again
There is
1 month later, pain, little bit pain start. So initially 4 to 5 minutes I limp, then it is adjusted. Then again your exercise I started, and after 1 month that limping was reduced, and continue it is 3 months, and almost limping is gone. Then I decided to come here first sitting, because I have done core decompression. I have no choice to do except the replacement.
So that means after doing the exercise, you are in so much confident that the exercise actually work on that.
Yes.
Yeah. Without any medications, you can reduce your pain. You can reduce your limping also.
Yes.
So if you follow the exercise, you will get a lot of benefits from
Yes,
it.
80% relief there. After first sitting, another 5 to 10% done. Now I have taken the second sitting. Now more than 90%.
Okay.
Relief.
Yeah. So overall conclusion is that if you start the exercise in your home, that means treatment is started, and you will get a relief from the exercises near about 50, 60, 70, whatsoever it is, you will get the relief from that. And if you get the relief, you can come to us, you can take the therapy sessions, and you will get a lot of relief from the therapy sessions. Okay.
Yes.
So overall, what is the conclusion you are observing?
My conclusion is I have searched everything. I have compared all of the options. Hip replacement, core decompression, other treatment also there.
Yeah.
So everything you can try, but natural thing is better than
Yeah.
other. So before going to any replacement, definitely we should try to
Just follow this.
follow this, because it is natural.
Yeah.
When it is not work, very in distress there,
then you can
then
go
it is
for the
destiny. There is no option.
Yes. Because in this treatment, we try to save your natural hip joint without any operation. By the help of the therapy session, we try to increase the blood supply in your joint. We try to save your hip joint. We try to stop the progress of the disease, and in the end, you can get. But if you are not getting the result, you can go for the hip replacement also. That is the last option. That is open for you forever.
Yes.
Okay, but before going to the hip replacement, you have to try this session, and definitely it will help you.
Yes, and all surgeons also suggested that you have to, as much as you can, delay the replacement.
Yeah.
So if it's possible to whole life without replacement, then good.
So if you want to delay the hip replacement, better to try this session. Try to take the therapy sessions. You will definitely get the results, and you will get a pain-free, limping-free life. Yes.
And I am expecting whole life without replacement.
Yeah.
That expectation is myself.
Thank you, Mahmood Rashid ji. And I hope you people have got a lot of information from this video, and this is beneficial to you. And if you belong to the Bangladesh, you can come to us. And you can want to speak in Bangla language also, if you want to say in the Bangla.
হ্যাঁ, বাংলাতে কথা বলতে পারি। যারা বাংলাদেশি আছে তারা ইচ্ছা করলে আসতে পারে। এখন যেহেতু সিচুয়েশনটা একটু খারাপ, বাট একটু সিচুয়েশন ভালো হলে আপনারা আসতে পারেন। বাট আসতে যদি সমস্যা হয়, এক্ষেত্রে আপনারা শুরুতেই এক্সারসাইজটা শুরু করে দিতে হবে। এক্সারসাইজ করলে 80% পর্যন্ত রিলিফ হয়ে যাবেন আমার মনে হয়।
ওকে, থ্যাংক ইউ, থ্যাংক ইউ।